Welcome back. This Saturday, May 1st, is Doctors' Day. The Source is pleased to welcome back Niagara Health Chief of Staff Dr. Johan Viljoen to talk about how doctors will be recognized. Dr. Viljoen, the falls will be lit up blue on Saturday at 10 o'clock. That's kind of exciting.
Well, that's very exciting and very humbling and very much appreciated. Physicians, all across the board have had a tough year of it. And, we celebrated Doctors' Day last year when this pandemic was just unfolding. And now after a year of unrelenting pressure, here we are again. It's good to take a breath, take a pause, and just recognize what physicians have done over this past year. The highs and lows we've had, the unfortunate losses our doctors have seen, the unfortunate conversations they've had to have and continue to have with patients and loved ones, under these circumstances. So to me, it's really an important point to just stop for a moment and say thank you again, for what they do, and whether that's our physicians in the hospital setting or our physicians in the community setting, everyone has pulled together to manage and support our community through this.
What does a doctor's life look like, especially those doctors that are contributing a lot of their time in our hospital system? What does their daily life look like over these last 14 months?
The focus for most physicians has turned to just one entity, one virus that is dominating everything. So every process we've been involved in had to be adapted to accommodate providing care in an environment as safely as possible. So not all physicians may directly care for patients who have active COVID disease, but every doctor and their care is affected on account of it. So if you're a surgeon and you are not necessarily taking care of a COVID positive patient, your ability to provide surgical care to your patients has been affected by the fact that our capacity has been strained. So everybody has had to deal with that. In how do you manage your patients in the safest, most compassionate possible way when this disease causes so much pressure?
For May 1st, for Saturday's Doctors' Day, the OMA, the Ontario Medical Association, is asking everybody to shine a light at 9 o'clock using their cell phones, flashlight, whatever else. What is the purpose of that, and are we supposed to reflect on thanking doctors at that time as well?
I think that is what would be very much appreciated. It's the thought. It's just the moment you take to think, wow, over the past year, what has been the impact that physicians have made on us. We received a fantastic letter yesterday from a very thankful family who had lost a loved one here at the very early part of the pandemic. And the letter was directed specifically to the doctor who took care of them at that time. And that was a time at which we were still uncertain as to what direction this is going to take. And they reflected on how much compassion he had shown in the care of their loved one. And their reflection was realizing it's now a year on, just thanking him and saying they think of him all the time when they see what's going on. And in celebrating Doctors' Day, I think that's the reflection I will have, and I think most of our community will, is just take a moment and think, this is a team that has really stood up for us. And again, I do not want to fail to mention our doctors in the community.
Those doctors in the community are extremely important in the whole scheme of things as well.
They are a vital part of our team. They have stepped up. I mean, if we look at our vaccination effort and if we look at our assessment clinic efforts, our doctors from the community, within a day or two after we put out a call for help, they stepped up in large numbers and continue to do so. So this is the one time that I've seen hospital and community really coming together and really working for our community.